Peptic ulcers disease. Peptic ulcer disease or PUD is a break in the inner lining of the stomach, the first part of the small intestine, or sometimes the lower esophagus. Inner wall of gastrointestinal line of mucosa. Consist of 3 layers. Epithelial layer. Consist of secretion and absorption of mucus and digestive enzymes. Lamina propria. Consist of blood and lymph vessels. Muscularis mucosa. This layer consists of smooth muscle which helps in contraction and breakdown of food. Causes: nonsteroidal anti-inflammatory drugs, or NSAIDs. It inhibits enzyme called cyclooxygenase which helps in synthesis of prostaglandin, causes gastric mucosa susceptibility ulcers. Second is Helicobacterium pylori. It is a gram-negative bacteria, which releases adhesions to foveolar cell as well as processes causing damage to mucosal cells. Mostly starts in antrum and spread to whole stomach. The third is Zollinger-Ellison syndrome, it causing gastrinoma which is neuroendocrinal tumor in duodenum, and pancreas, secreting abnormal amount of gastrin. Gastrin stimulate parietal cell to release excessive amount of hydrochloric acid and causing ulcer. Fourth cause is stress. In people under severe physiological stress, ulcers may result from changes in the body's pH. Types: gastric ulcer and duodenal ulcer. Ulcers are small, punched-out holes in mucosa with clean base due to hydrochloric acid. Signs and symptoms: epigastric pain, which mostly aching and burning upper abdomen, bloating, belching, and vomiting. In gastric ulcer there is aggravation of ulcer pain while eating food, but in duodenal ulcer pain are relieved by eating. So, in gastric ulcer we will find weight loss, and in duodenal ulcer we will have weight gain. Complications: perforation, allowing gastrointestinal contents in peritoneal space. This causing irritating of phrenic nerve, causing referred pain in shoulder. Long-standing duodenal ulcer near pyloric sphincter, causing edema and scarring, and obstruct the normal passage of gastric contents, causing nausea and vomiting. Diagnosis: upper endoscopy, which are introduced to stomach and proximal end of duodenum and takes biopsy. In management: treating the underlying cause, like smoking, NSAIDs, H. pylori.